Hi, everyone. This is Maria Corona, Chair of the OCA Health and Welfare Trust and OCA First Vice President. On behalf of the OCA Health and Welfare Trust and the OCA Board of Directors, we're honored to welcome you to our biggest member event of the year, an annual health extravaganza featuring screenings, access to fair sponsors, lunch with your fellow union members, and more. Last year, we had our biggest year ever, over 4,000 health fair attendees. I'm thrilled because this year, we've expanded the health fair to accommodate all of you. Don't forget, this year, the health fair takes place from 11 a.m. to 2 p.m. on Thursday, September 11th. As you may know, OCA started in 1937 when a group of county employees banded together for better group insurance rates. In the 88 years since our union has grown to become one of the most well-respected in the state, a leader among public employee unions. Since its inception in the mid-1990s, OCA's Health and Welfare Trust has been here to provide members with supplemental enhanced coverage that goes beyond what is offered to you as a county employee. Our work and this event are about you and your well-being. Welcome to the 2025 OCA Health Fair.
Hi, I am OCA President Judy Bowling. On behalf of the OCA Board of Directors and the OCA Health and Welfare Trust, I want to thank you for watching this video. Don't forget that OCA open enrollment is until September 19th, 2025. If you attend the OCA Health Fair, we hope you'll enjoy the screenings, food, and fun. If you're a member who couldn't make it, we'll be bringing a gift from the health fair to select work sites soon. Thank you for watching this video and happy Health Fair 2025.
Hi, my name is Tracy Mills. I'm one of your benefits staff members at OCEA. OCEA holds its annual open enrollment period in the month of September. This year it begins September 2nd and ends September 19th. It's a time to review your plans and submit changes to your non-medical benefits. You do not need to do anything if you don't want to make any changes. OCEA open enrollment benefit packets will arrive at your home during the first week of September. Included in the packet is a cover letter describing your current OCEA benefits. Please remember this is not your county medical open enrollment. The county will hold their own open enrollment period in the month of October into November. During OCEA's open enrollment period, you may change your dental plan, add or remove dependents to dental and vision. OCEA has basic dental plans available with no premium from the paycheck, and OCEA members have 2 upgraded dental plans to purchase for themselves and their family. You may choose between an HMO or a PPO dental plan. And OCEA members who are part-time may also purchase dental plans and vision service plan. Employees receive a basic disability benefit through OCEA. The benefit is used when your doctor disables employment due to an illness, surgery, non-work-related injury, and pregnancy. OCEA members may elect to purchase supplemental disability during open enrollment without going through a medical history approval process. The plan may pay a benefit of up to 60% of salary after 91 days of disability. The benefit pays until doctor says you're able to return to work, and if one is permanently disabled, the plan can pay up to age of 62. OCEA members also may elect hospital indemnity, accident, and/or critical illness insurance for themselves and their families. These plans are meant to complement your existing medical, not to replace it, and the plans pay a benefit to you, not the medical provider. All 3 of those plans have a health maintenance screening benefit, which pays per calendar year for screenings such as cholesterol, EKG, lipid panel, etc. You can find plan information, premiums, enrollment forms in the enrollment packet and online as well. If you wish to submit changes in your OCEA benefits, you may send the completed enrollment forms through the Postal Service with the postage paid envelope included in the packet. You may email the forms to benefits@ocea.org or you may complete the forms online using DocuSign. We also have a mailbox located in the front of the OCEA building. You can deposit the completed forms there. All changes need to be received and or postmarked by September 19th, 2025. So to recap, OCEA's open enrollment starts September 2nd and goes through September 19th. It's the time to review your plans and submit changes. Any changes you submit should go into effect January 1st, 2026. And as a reminder, you do not need to submit anything if you don't want to make any changes. Further details, you'll want to review the OCEA benefit packet. And thanks very much.
Hi OCEA, this is Michelle Trong from OCEA's organizing team. If you're coming to the health fair this year and you're within walking distance, we encourage you to walk over. If you're shuttling in from one of our 7 designated shuttle stops, check your home email. We'll have sent information about your location shuttle stop leading up to the health fair. If you're coming to the health fair by car, please carpool with your coworkers if possible. Parking will be available for you by driving through the Blue Arch and into the parking lot at West Civic Center Drive and Van Ness Avenue. Additionally, OCEA has rented many of the parking meters around our building for your convenience. If you see this sign that says OCEA Health Fair Parking Only and you're coming to the health fair, that's it. You're safe to park there. See you soon, OCEA!
Open enrollment is a time of year where you can change your benefits coverage, add or remove dependents, and enroll in a flexible spending account, such as the healthcare and dependent care flexible spending accounts. Mark your calendars. The County of Orange's 2026 open enrollment runs from October 15th to November 4th, 2025. Starting October 6th, visit hrs.oc.gov/2026 OE Actives to explore tools that will help you prepare for open enrollment, such as the 2026 health plan rates, the summaries of benefits coverage, health plan comparison tools, and the What to Know guide. You can make your elections during this period on your benefits portal by visiting mybenefits.ocgov.com. If you would like to make your elections over the phone, you can also call the Benefits Service Center at 1-833-476-2347. They're available Monday through Friday and will offer extended hours during open enrollment from 8 a.m. to 7 p.m. Don't forget, you must re-enroll in the flexible spending accounts. The default option during open enrollment is no coverage for both the healthcare and dependent care flexible spending accounts. The Healthcare Flexible Spending Account has a $3,300 max annual contribution and a $660 rollover, as long as you re-enroll for the following plan year. The Dependent Care Flexible Spending Account has a $7,500 max annual contribution. This plan does not have rollover options, so plan accordingly. If you do not take any action during open enrollment, your coverage for 2026 will default to what is displayed on your My OC Benefits account. So don't forget to make your open enrollment elections by November 4th.
Hi, I'm Sylvia with OCEA Special Events. OCEA Special Events is the place to go for OCEA members in need of tickets to Southern California's best attractions, sporting events, theme parks, movie theaters, and much more. We even have seasonal tickets to Wild Rivers, Universal Studios, Halloween Horror Nights, and more. OCEA members can purchase tickets at the OCEA Special Events office at the OCEA office in Santa Ana from 8 a.m. to 5 p.m. Monday through Friday. Some tickets are available only online, and you can purchase those by logging into the OCEA website and going to the Tickets and Discounts page under Member Benefits. We hope you'll take advantage of this great member benefit all year long. Happy Health Fair.
Enrolling for your benefits? It's one of the most important things you'll do. Not just for yourself, but for the people who count on you too. So even if your employer doesn't require you to actively enroll, that's no reason to just lay back and take it easy. There are lots of good reasons to enroll for your benefits, when you're first hired and every year after. Here are 5. 1. If you're a current employee, there may be changes to the benefits and benefit options available to you, including changes to what you pay for them. 2. If you're a newly hired employee, you're going to want to look at all the benefits and options your employer offers you, and then choose the ones that work best for you and the people you cover. 3. If you don't actively enroll, you may be assigned coverage. This may not be the coverage you need or want. Plus, there may be benefits you can't participate in unless you actively enroll for them, like a health savings account or flexible spending account. 4. Many people are overinsured. That is, they're paying for coverage they don't need or use. Benefits are expensive and will probably be even more expensive each year. Enrollment gives you the opportunity to fine-tune your coverage and stop wasting your money. So, look at your options and think about what your coverage needs really are. Then make your choices. 5. You may have had changes in your life that would make new benefit choices a smart move. Hey, your life doesn't stand still, and the benefits that worked for you in the past may not work as well in the year ahead. Enrollment is your chance to get the benefits that will fit your life. Actively enrolling for your benefits? It makes a lot of sense when you have the know-how.
When you think about your healthcare costs, the first thing that comes to mind is probably your premium, the amount that comes out of every paycheck for your health coverage. Your premium is a fixed cost. You're guaranteed to pay that amount during the year, even if you never go to the doctor or get a prescription. But if you think your premium is your only healthcare cost, you're not seeing the whole picture. You also need to include healthcare costs you pay out of your own pocket, like when you go to the doctor or get a prescription. To see your total healthcare costs, you need to take what you pay for coverage and then add what you paid, or think you'll pay, out of pocket for healthcare services during the year. Out-of-pocket expenses can include things like your deductible, what you pay before the plan starts paying benefits, and your portion of medical and prescription drug expenses you share with the plans, called copays and coinsurance. Different plans will result in different out-of-pocket costs, so look at them carefully. Out-of-pocket costs are variable. How much you pay depends on how often you go to the doctor, how many prescriptions you take, and how much your plan pays for services. Generally, the lower your premium, the higher your deductible and the more you'll pay out of pocket. The higher your premium, the lower your deductible and the less you'll pay out of pocket. A low premium is tempting, but maybe you're worried about paying a high deductible and potentially high out-of-pocket costs. After all, out-of-pocket costs are unpredictable. Who knows what might happen? You might have a really big medical expense. Relax. You're protected against really big medical expenses by your plan's out-of-pocket maximum, which limits the amount you'd have to pay in a year. Plus, you can use a healthcare flexible spending account or, if available, a health savings account to help you pay your deductible or other out-of-pocket costs. So you could consider going with a plan with a lower premium and use the savings for your FSA or HSA to help meet your expenses. Sure, you have to pay a premium anyway, but why pay a higher one if you don't have to? The bottom line, look at your total healthcare cost, what you pay for coverage plus what you'll pay out of pocket, then make your decisions. Getting the best deal for you and your family is easier with a little know-how.